Okay, I'm hoping that we're live and I'm hoping people are in the session and able to hear me. I'm sure I'll get a message in the chat box if that's not the case, but hopefully you can see and you can hear me. And welcome to this information session run in partnership between Nursing Now and us at Health Action Training. I'm Dr. Karl Tizzard-Kleister. I'm one of the directors, co-founders of Health Action Training, and I'm going to be moderating this session. And I'll introduce the rest of the group who's here with me from Health Action Training in a little while. First off, I want to give you a quick overview of the session and of Health Action Training and the project. This is an information session, and the aim of the session is to give you guys, everyone out there, a chance to find out about Health Action Training and Nursing Now and the project we're doing together with the kind funding from the Burdett Trust for Nursing based in the UK. So first off, I'll introduce myself. I'm Dr. Karl Tizzard-Kleister. I am a doctor. I finished my PhD last year, and as far as I know, it's the only drama and nursing PhD in the world, which there's probably a good reason for that. But anyway, I helped to set up Health Action Training as a company. And the long and short is we deliver healthcare training for professional healthcare practitioners, mostly nurses, particularly when we've been working here with the Nursing Now Challenge. And what our uniqueness comes from using a applied drama approach and actor training to teach communication skills and person-centered practice. That's our key unique selling point, for want of a better term. We've been really, really lucky over the last year and a half, coming up to 2 years, to be working with the Nursing Now Challenge in partnership with Burdett on a global project, bringing our training to nurses around the world through Zoom, which, Zoom has got its perks, we find. That's enough talking from me. What we're going to do next is share a video that will give you some insight into the project. It's probably much more interesting than listening to me talk. After that, what I'll do is I'll invite the panelists to join and introduce themselves. Then we're going to have an extended Q&A session, so everyone can ask any questions they have or find out information they'd like. We'll share our contact details and everything at the end if you have further questions after. That's enough from me. I'm going to now ask Andrea if she's able to share the video link and play it so everyone can see that.
Health Action Training provides specialised communications training for nurses and midwives. We draw on applied drama, actor training and person-centred practice to help you communicate effectively, manage stressful situations, lead on solving problems and learn from perceived failures. We're pleased to partner with the Nursing Now Challenge to bring our unique training to members of this global network, supporting nurses and midwives around the world. Our bespoke courses are accredited by the Royal College of Nursing, the CPD Standards Offices and the Nursing and Midwifery Board of Ireland. Over 95% of our participants strongly agree that our courses provide a positive learning experience. For many, it's game-changing. And thanks to the support of the Burdett Trust for Nursing, it's completely free of charge.
My learning journey began with Health Action Training, and arriving at my third course with them, I feel more positive. At personal level, I'm more resilient.
The experience in itself was something extraordinary. It was just amazing, and I feel like I'm a better person for it.
To learn more about our approach and register for an upcoming course, visit the Nursing Now Challenge website.
There you go, wonderful. I couldn't have said it better myself. And you will recognize some of the people giving some testimony in that video. We've got both of them joining us here today. And maybe we'll start by introducing them to you all. So first off, as I can see her camera is on, I'm going to invite Rita to unmute and welcome herself, introduce herself and tell you all about her experiences with Health Action Training.
Well, thank you, Karl, and thank you for having me today with you. Thank you for Nursing Now Challenge, who was opening always those great opportunities for us as nurses and midwives. Well, I'm very happy to share my experience with health action training since really I've been with the team as learner for more than 1.5 years. And my learning journey is just like amazing. And I invite everyone to join us. So all the time that I spend here is very fruitful. And I want to share a little story. Like a year and a half ago, I was struggling with my daily challenges. I live in Lebanon. We have like every day a new challenge, multiple crises, and I was overwhelmed. Then I received this email from Nursing Now Challenge that is inviting me to join health action training with coping with the crisis, well-being, and the growth. And I felt like this is my like life gift. I really need this. And I was curious to know what are they doing? What is this drama, applied drama? What is this doing with nursing and with all this, like what we learn in school, and we learn about being kind, being believe in others, but not in the way that health action training is learning us. So I joined this course and I learned new practices. I learned to be like sympathetically present, not just listening to the people, but involving them, not just doing a shutdown, facing the pain, but knowing how to do my burnout cycle and to be like resilient, but not the usual resiliency. It's another way of being resilient and coping with daily challenges. Also, what I learned and I loved is this applied drama. You know, we are in a virtual room, not in life, real life, like we are used to learn, but it is a virtual room, lots of cultures, lots of people from other countries. I've never been like to India, but I had a colleague from India. I didn't travel from Lebanon, but now I know all cultures. I have lots of friends in all over the world, so I am having connections with everybody. And also, by the drama scenarios, it's not the usual learning like we have learned in university. It's a new way of role play. So you are in the shoes of the patient. You understand the family, their concerns, what they are believing in, what are their preferences, and we learn how to listen to them. And also with the forum theater, that is amazing. We know to have lots of characters, and everybody is enjoying this way of learning. And also I have learned to be like patient-centered environment. And it was the first time I heard about person-centered care. And this is really, really very important nowadays, especially after COVID, after multiple crises that we are living in. So we know how to make decisions with the patient and all caregivers, and not to replace the patient, and also how to deal with the challenge every day. I know how to observe and how to listen and how to deal with my daily challenge and at personal level. And this was really my biggest like learning. I'm more resilient. I have my breathing exercise that I do every day. So it's like my lifestyle now. Every day I woke up, I clean my face, I do my breathing exercise, and I know what I expect from myself. And this is what amazing to endure all those challenges. And also I learned how to comfort, how to be kind, how to reassure others, not in the usual way that we are used to do simple words and go from room to another. No, I know now how to deal with my time and how to speak to my patients. And also, what I'm happy to share is that this learning is not just for me and not just sharing this today with all of you, but also with my colleagues in my hospital. So, you know, we are a hospital in Lebanon, and we speak more French. So when it comes to the English barrier language, it's like very tough. But with health action training team, about 15 of my colleagues are happy to join sessions and to learn more and to be more resilient without this language barrier. And this is amazing. And also I invite even the French people speaking to join those courses, because there is no barrier, not language, not culture, no barriers in these courses. And finally, I would love to tell you that in our hospital, as nursing department, we have adopted the person-centered care as our project for 2023. And in 12 May, we are like putting update on this program, because 12 May is the Nurses International Day. And this is amazing how now we are more like a team. We are more helping each other. We feel like one unit in a big hospital. So thank you for the Nursing Now Challenge, and thank you for Health Action Training, and I invite everyone to join us. Thank you.
Oh, thank you, Rita. Oh my goodness. Well, and that's why this session we wanted to give the voice to folk like Rita who have joined us, because I could not say anything better than that. And thank you so much for sharing your experience with us, Rita, and thank you so much for your commitment to kind of everything that you've been doing with us and with what you do every day in your job. Thank you, Rita. We're going to hear from another participant, and I'm going to choose Asma. If you wouldn't mind unmuting and showing us your face. There's Asma. Wonderful. Asma, over to you.
Yeah, yes, Karl, thank you very much. I'm Asma Soui, Advanced Specialist Nurse from Jordan. I work at the Ministry of Health at Training Center. Actually, I want to thank Health Action Training and the Nursing Now for this really lovely experience that I would like you all to participate in, and you won't regret it, because as Rita said, it's non-traditional. It's something new experience that you will enjoy. It's interesting, and it's joyful, and it's useful as well. So I just want to highlight the main things that you might benefit from these courses. So first of all, the communication, which is really, really important in our life and in our work as nurses. So taking these courses will really, really improve your communication, not the way you communicate, but also how to understand others' communications. It focuses a lot on the non-verbal communications. It's not just about understanding what others say and acting. It's just also understanding what they are hiding and what is behind these talks and feelings and breathings. So it's really, really important in our work and in our life. The other thing also is the sympathetic presence, how to be there for others. We always hear about the sympathy and empathy in nurses, but this really helps you to practice these presence and how to be sympathetic with others. Another thing is the person-centered care. And as Rita said, we take in nursing schools about the patient-centered care actually, but we never take it from the general concept that's the person-centered care. So this is the one thing that I like at the first class that I take at the Health Action Training, is that you have to be person-centered care on patient, on family, and also on yourself. And that's where comes the breathing exercises, relieving the stress, being more resilient, and finding a support system, understanding how you feel, acknowledge yourself, and so on and so on. These things that we don't really just focus on in our life. Not all the institutions we are working on supporting the staff. The main concept always is on the client. So these things you have to take in considerations, and you will learn a lot of techniques in these courses. Another thing is also solving the problem through the drama techniques. This is the first time I try something like this, the role play, the applied drama, the forum theater, and so on. It's really interesting, funny, and it's important because we are dealing with human beings at hospitals, patients, care, and if there is some problems or issues that you are trying to solve or find a solution for, it's not always applicable to just try it by trial and error like other professions. So using the applied drama to put yourself and others in the situation, finding solutions and suggestions and trying what is working out is really, really important, because it's, in the end, is drama. It's not a real life. You are not going to kill a patient by trying these solutions or this way of communication or handling these situations. So it's really, really important. I would also appreciate thing in these courses that is multicultural, you know, people from all over the world. You are enjoying your time. It's really, really new experience. I guarantee that most of nursing schools are just rigid. We might take some role play activities, but it's totally different. The applied drama, the forum theater, the I don't know, the high status, low status exercises, it's all help you to understand yourself, understand others, and define your objective in life, in work, in your personal life, and so on, and how to communicate with others. So I really, really invite you all to be part of these courses. I had the chance and let me say I have the honor and the really to be a participant in these courses. I took the grad certificate courses, and then I really wanted to be more participating in these courses. So I had to take the TOT for healthcare actions training, and thanks to nursing now it was free charges. And then I am now trying to go through that path. So I am now working as assistant at some course. And I hope that I will be someday, maybe like Karl, helping others and teaching these activities and applied drama. So it's really, really interesting courses, useful courses that benefits you, either at work, personal life, family life, emotional life, your resilience. So it's really important for you and it benefits you. I will invite you all to take these courses, and thank you very much.
Thank you, Asma. Thank you so much. And I'll echo it. We are so overjoyed to have folk like yourself join us, and we learn so much from all of you. And you know, it's wonderful to hear that you learn so much from us, but we learn something from each of our participants. It's a true sharing of experience. Thank you for sharing that, Asma. And I'll mention there, Asma was talking about what we call the Train the Trainer program. One of our big aims, especially with this Nursing Now Challenge project, is to develop trainers who can deliver our health action training wherever they are in the world, and in the way that makes sense to them with our continued support. Maybe Hazel, who has also just finished the Train the Trainer course, might be able to say hello, introduce herself, maybe speak a little bit more about that process of being a trainer and whatever else you want to say as well. Hazel, thank you again, Asma. Over to Hazel.
All right, so good morning again, everyone. I'm Hazel. I'm a nurse before in the Philippines. So it was the Hat family who has witnessed my transition when I moved here in the UK. So I'm currently a deputy ward manager at Priory Hospital, North London. But I'm also a part-time faculty in one of our university in the Philippines. So I'm doing some online classes via Zoom to still teach students nursing course in the Philippines. So when I first started here in the health action training, I was still based in the Philippines. I was just so intrigued, like drama in nursing, and yes, drama in nursing. So as it was very intriguing, like how would you incorporate this drama principles, this drama techniques in trying to teach how you're going to, let's say, learn how to communicate effectively. How are you going to communicate or break the bad news? How are you going to be culturally and ethically considerate in terms of communicating effectively with different nationalities, with different people? So we know that nursing is very encompassing, and that majority of our what they call this, like, practice is very internationalized, that we are moving to internationalization, that we want to be culturally and adept, I would say. So the health action training is actually one of the best, let's say, avenues for you to learn how you can practice and develop more of your communication skills. So I had the chance to also be part of the graduate certificate training, where I am also now a trainer of the health action training. So as a trainer, we are now dealing with different theories like behind why was this program created in this manner? What is the theory behind that? So it's a combination of both nursing and drama principles being like glued together, soon like a stitch. I think that would be the best description for that. That you will be able to explore and get the best of both worlds of drama and nursing in order for you to further on your communication skills. So without further ado, although we are talking about this communication pattern of talking about this person-centered nursing, the focus of the health action training is about sympathetic presence. And that also means you have to also take good care of yourself. So it's not just a matter of just learning or let's say improving the way you are communicating, but it's also how you're going to build the resilience that you have. So I'll pass this back on to Karl.
Thank you so much, Hazel. And it was a joy to see your transition to working in the UK and be part of that in some small way. So thank you. Thank you very much. We are going to now hear from Zipporah. Can you see and hear me? Can you? There we go. There's Zipporah. Over to you, Zipporah.
Hi, everyone. First, I want to say it's an honor being connected to all of you all over the world, and this being World Health Worker Week. I wish you all the best in your work, and we celebrate you as nurses and midwives, wherever you are, and the job you're doing is amazing. My name is Zipporah Iregi. I am an early career nurse and now working in advocacy and communication in the space of public health with the African Union and IntraHealth International on 2 different projects. And I was privileged enough to be part of the graduate course with Dr. Karl and Matt and Pat. I hope you say hi to them, by the way. And it has been an amazing experience. And I know I keep saying that, but truly it has been. And, you know, I think a lot of us do not take the importance of communication very seriously. And I feel like most of our jobs as nurses is communicating with patients, communicating with families, communicating with communities, whether it's in advocating for them or also just trying to help them through their process of care. And, you know, and through HEART, I learned the importance of being very self-aware personally as a nurse or as a person who is communicating to people, understanding what is going on around me, understanding what I'm feeling at that point, and also being able to understand what the other person is feeling and what my actions are doing to them, you know, and how I can objectively pass on my communication, how I can be objective in my actions to ensure that I'm achieving what I wish to achieve or what behavior I would like to develop with the other person. And, you know, these themes and these lessons that I learned in HEART have even helped me in my advocacy and communication. They just do not apply in the clinical space. And I know that a lot of us here are also, you know, venturing into academia, into leadership, into policy making. I have grown in my communication, you know, even as I do these projects, even as I'm meeting, you know, individuals, which is a major part of my work, you know, to be able to, you know, sit with people in big rooms and actually understand where are we at this point, you know, where are we going? How can I use communication as a tool to get there? And even as we speak about this aspect of, I think they're going to mention cargo and other aspects that you're going to learn through the course, you know, being very aware of who is in the room with you, what time are you having that conversation, you know, what circumstances have led to this conversation, then how can you use this as a tool to be able to present yourself better. And I think it has made me a better person, honestly. And even when I'm not consciously thinking about it, I'm always like employing these techniques that I learned in HEART, because, you know, as you're trained, you keep doing these practice sessions, you keep practicing with your colleagues, you know, even as you build these relationships, and you will find that slowly and slowly your behavior changes. And I think the speaker who came before me said that people have noticed that transition, and even for me, I have noticed personal growth because of this. And I would highly recommend that all of you be signed up for this course, and even if you can, you know, get to be a trainer of trainers, and let's make all the healthcare workers go through this, because I know it will greatly impact the kind of work that we do, even as we advocate and communicate with our communities and families. So thank you very much.
Oh, thank you very much, Zipporah. Thank you, and I really appreciate that it's still happening, because it's a fair while since Zipporah joined our grad search. She, I think, was on the very first one we did with Nursing Now, which is over 1.5 years away. So I'm so glad it's still paying dividends for you, Zipporah. Thank you so much for sharing, and we hope to see you on a course soon for sure. And the last but certainly not least, and they have arrived there, Zoe. Are you able to unmute? And there we are. There's Zoe. You, Zoe.
Yeah. Hi, Karl. It's really nice to see you again. And hi, everyone joining in this webinar. I really want to thank the Nursing Now Challenge. But I think first I will share that I'm a nurse. I live in Mexico City, and I work with private consultation for the design and develop of projects in health, particularly in occupational health nursing and community health projects. And in my experience, I had some training in person-centered practice, placing the client at the center of the actions. But I really want to share that health action training is a unique approach to this framework. I want to highlight how important is this course in the context of Nursing Now Challenge as training and develop leadership platform for nursing, for nurses and midwives in the world. In one hand, I truly believe this course is open to all voices. Learning with nurses and drama practitioners was really enriching. It was really delightful to share perspectives and knowledge. And in the other hand, I really admire the work that has been done to reflect and practice through as this selection of applied drama techniques and person-centered care as a framework from nursing, because it's really interesting how we can use this framework, person-centered care, as a nursing knowledge, as a nursing practice itself. So through this evidence-based approach, carrying out this training in communication and how we can enrich the participation of the clients or the patients in their own health, it's very, very, very valuable in all contexts. And particularly for Mexico, is something we really need to do in healthcare sector, because I mean, probably not just in Mexico, but we focus the training for health professionals in the clinical aspects of the delivery of care. So it's really valuable that we have this opportunity to train other skills like communication, active listening, sympathetic presence with the clients, with the patients, but also with ourselves as a healthcare providers. That was really, really important to me in this whole year we share with you, to know that I'm a person too, and I have feelings and I have reactions to these challenging situations we have in the delivery of care, and we must to train ourselves how to manage that situation. So it was really, really important to know that the person-centered care involves the healthcare professionals and their own responses to these challenging situations. So I really want to invite everyone to participate in this kind of training, because it's very, very, very unique, but also very valuable in the health sector in general. So thank you very much for the space, and congrats to everyone to being part of Nursing Now Challenge projects, and particularly with Health Action Training.
Thank you very much, Zoe. And I want to echo a word I've heard a few of you say, enriching. And I can't tell anyone here enough how much each and every one of you have enriched the sessions that you've been a part of with Health Action Training, truly. And thank you all for being here and giving your time to share your experiences. What we're going to do now is we're going to invite the attendees of the webinar to ask some questions, maybe seek some clarification on things. You can ask it of the whole panel, or maybe there's something you'd like to know from one of the panel. So if I could ask the panel all to make sure that their cameras are on, at least for now, so everyone can see. And then if there's a question, I'll direct towards your way. If you have a more involved question, you can message Nursing Now Challenge in the chat box, and behind the keys there is Andrea, the wonderful Andrea, and she will make sure that you can speak to us and then we can hear you. If it's a quick and easy question to type up, please do go ahead and write it into the chat box. I'm going to be taking those questions and putting them to the panel. But whilst you all have some time to write up any questions you might have, I'm going to ask a question to the whole panel, and maybe they can each come in whenever they want to. I'm always fascinated by that first moment that a nurse joins our course. And I think, Hazel, you said it, drama, nursing, how does that work? I want to ask you all, what was your experience like initially, from going from a space of not knowing what we were doing, what drama had to do with nursing, to where you are today? Does anyone want to talk about that a bit?
Yeah, I won't start, that's okay. Actually, Karl, I remember the first, maybe first 1 or 2 sessions, it was really weird, and it's something strange for me. They started the breathing exercise and the exercises for energy exercises and so on. So I'm not used for that. I was just feeling weird about it. But then after practicing it, they encourage us to practice. While practicing it, I felt that it's really improving my psychological status, and it's really benefits to me. So I started to like it. And later on, I was just waiting for these exercises, like the rubber chicken, the spinal rolls exercises, and so on. So I was waiting for them at the next 2 and 3 courses. So at the beginning, you might feel it's weird because we never did that before. We never did that before, not watch it or practice it. The drama was really, as I said, interesting. And maybe for me, one of the things that I really liked, and it was really brand new for me, is the applied drama, the foreign theater. I really like that idea. And actually, as a trainer, I use it in my training. It's really effective method for training others and teaching others. And it's, let's say, new and unique. And it's beneficial. So at the beginning, I take the experience, I like it. And then I try to apply it at my work. And I like it, the participants like it too. So at the beginning, it's a whole new experience, but while doing and going through that journey, you're really enjoying your time, and you are learning really new things that you can benefit even at your personal life.
Thank you, Asma. Thank you for the insight there. Sorry, Rita.
I would like to highlight something. For me, the challenge was not to go from a place that I don't know to learn with the health action training. For me, it was more like I need also to bring this picture to the persons that are in charge in my hospital and to other colleagues. And here was a real challenge because, you know, every day I was learning something new and I was transmitting this picture, and what was really challenge is how to transmit that you are laughing in those sessions. So usually we learn like we have a presentation and then we have an evaluation, But here with health action training, we have practice exercises, we have breathing exercises, we have to be present. And what is really amazing is when you really go through those courses, from the small, the short courses to the graduate courses, is that you can bring others with you. And I have the support nowadays, for example, I have the support of the direction in my institution. And during our work, during the usual hours of our work, we are assisting to the health action training sessions. And this is amazing. So it's not just that I am doing it, my colleagues are also enjoying this, and our responsible, the HR department and the general direction are considering this as a part of our work. And this is the real shift in the way that usually, in crisis time, hospitals think about. So nurses just near the patient. Now we have this time, we take our time, we assist to health action training, and we develop our skills in communication and well-being and mental health.
Amazing, Rita, and you're tapping into something that's been asked in the Q&A section there, which I didn't know was a thing. Which I'll ask that question to the panel in a second. But is any Hazel, Zoe, or Zipporah, any thoughts on that initial? Hazel, yeah.
So yeah, in terms of what I mentioned before, drama in nursing. Well, drama in nursing is not actually a new concept. If you have noticed, I think it has been incorporated in different nursing curriculum internationally about having simulated nursing or case scenarios wherein students are being asked to role play something in terms of, let's say, this is the case presentation or this is the case scenario. A student will, let's say, be acting up as a patient. One of the students will act up as a nurse. Let's say one of the students will act up as a doctor, to give that enriched simulation environment on how they're going to deal or address different medical, surgical, or psychiatric problems. But what makes health action training unique in such a way that it gives you now the background, what is the science behind this drama? Why are we doing this? What are the, let's say, theories behind it? What is the step-by-step? Like, why is it like this? Why is it not like that? So the health action training is going to provide you information on how you're going to deliver effectively this role play scenario so that you can better improve yourself in terms of how you're going to facilitate, let's say, a role-playing scenario, not just exactly in terms of students, probably perhaps when you're with your colleagues. Let's say you have this certain puzzling question in your mind, like, how am I going to deliver a bad news to a certain patient? Maybe you can drag one of your colleagues with you. Can we do some practice on how I'm going to deliver this, bad message, and then give me a feedback as to, am I communicating effectively? Was it done better? How can I improve this thing? So the health action training is going to give you this theory, this knowledge, this background about drama, but of course tailor-suited in terms of the nursing, on how it's going to be applicable in nursing. So when I started, drama wasn't a new concept in terms of role playing, but going back, it was health action training who gave me the theories behind those role playing scenarios.
Thank you, Hazel. There's a hand up there from Asma. Asma, something to add to something Hazel's mentioned there?
Oh, no, actually, but I just remembered at the beginning when I started these courses. I would like to say that my family, when they were watching me taking these courses, they thought, well, I was playing at the beginning. And so, are you taking courses or are you playing? And it was just, I think it's both. So it's really, that's the cause that it's, and later on at the TOT, we take that, how this drama started by learning teaching the children through learning, through playing. So it's really interesting method to learn by playing. I just remembered that, and I have to share it with everyone. Learning through playing is one method that you can use the drama in. That's it.
Thanks, Asma. Yeah, we hope it's fun, and it seems like you guys have all had fun, all you folks have. Thank you, Asma. The hands are coming up from the panelists here. So Zoe, you just had one up, but it went down. Is there anything you wanted to share?
Sure, just want to share that I truly believe that the theater and drama is really human expressed in all kinds of senses, because the acting work involves the body and the emotions and the backgrounds we have as a person, and involves the voice projection, and a lot of things are there. But was since I take these courses, that I understood how to apply that knowledge in my profession, how this human expression can be applied to the setting of the care delivery, because we are there with a person as a person, and we share the same space and the same context in that particular moment. So what's really interesting at the beginning, like reflect how this can be applied in nursing, right? But if I can share something really quickly now, is that through training, the body conscious, how the body feels, how the body extends, how the voice has been projected in a delivery of care setting, can improve the communication, the confidence we have with the client, and how we can help them to improve their health, right? So was really surprised the thing at the beginning, but through all this year, I really enjoy discover how this can be really useful for nurses and health providers in general.
Thank you, Zoe. Thank you so much. And we also had a hand up from Zipporah.
I was just trying to remember, like, the first day I got into the heart class. For me, it began during a tester session, and we were doing the "How are you? I'm fine" exercise. And at that point, I was like, I don't know how this applies to nursing, but let's go along with it and see where it leads us. And then as we went on with the sessions, I remember there was one day I had such a bad day. And then we came in and we were doing all these exercises. And by the end of the class, I was like, I am pumped, I am stoked. I can do this over and over again. So I mean, it began with at the point where I was not sure how acting marries into nursing. But then at the end of it all, it just all came beautifully to show, how all these courses are interrelated to help us improve ourselves. Yes, thank you.
Thanks for sharing that, Zippy. Thank you so much. We have a couple of questions in the Q&A box, and do keep any questions coming. So we've got one here from Muna Mohammed. Do you plan to repeat these sessions? I think I'll take that one quickly. Yes, we do. As I mentioned earlier, we are coming up to halfway through our 3-year project with the Nursing Now Challenge, with the kind funding of the Burdett Nursing Trust. That feels like a catchphrase I have to repeat, but it's true. We have many sessions planned for the future. I'll tell you more towards the end of the session when they will be. So yes, we are planning to repeat those sessions. Zoe would like to answer the question live. No, okay. Sorry, the Q&A function, I'm not sure how it works either, but we're gonna go back to another question that came there before. And apologies if I'm mispronouncing your name here. Shatrughan Parikh asks and says, thank you, Nursing Now, for such a wonderful initiative. It's very kind of you to say. And then, how much support was provided by your institution in the challenges? I guess, are you meaning support to join the Nursing Now Challenge and those other things? I think that would be a good question. So open to the panel. The question is, how much did your institution support taking part in initiatives like ours alongside Nursing Now, the Nursing Now Challenge? Any insights from the group? Rita?
Yeah, I would like to highlight that, first of all, when we as institution at Beirut, we joined Nursing Now Challenge, we had this project via the nursing department. So we put like a plan, and we get a meeting with our general director, and we presented it as an added value for all nurses, and not just nurses, but all for all the employees in the hospital. And during this interview, we was asked a lot of questions, and we did not get out from the room without having his signature in our plan. And here comes our leadership skills to go through this journey with Nursing Now Challenge. And every opportunity that we are having via Maze from Nursing Now Challenge, we are presenting it as a new opportunity for all the institutions. We are like a private hospital. So first, it is free of charge since it is via Nursing Now Challenge. And second, we are asking to put in real life what we are learning. So when I learn about health action training, I transmit to my colleagues. And when lots of voices are asking for the same question and the same need, so like this, you are having the support of your responsible in your institution. And the most important is that they are seeing this impact on your daily work. For instance, we learn how to break bad news for patients. So we have a small commission right now with persons that are learning with health action training, and they are the first intervenes near the patient that is having a problem like end of life or a cancer that is not curable and so on and so forth. So like this, you can have the involvement of all your colleagues and all the persons in your institution. And the most important is that everyone speaks the same language and they can feel the impact on your daily life. So for instance, now with health action training, every Thursday, there is 15% from one PC in our hospital because we have problem of connections in Lebanon and electricity. They are joining the course of health action training during their work hours. So they are paid to join for free health action training. I think this is a way to handle, especially when you are working in crisis time. I hope that was helpful.
Yeah, thank you so much for sharing that, Rita. So it sounds very much like you've had an experience where a lot of people where you work are interested in and buying in, for want of a better term, to this. But it might be different for people who are seeing these courses and think, I'd want to take part. I'm one person in an organization. How do I go about that? Has anyone on the panel had that kind of experience where it's you as in the institution and you're trying to negotiate that with where you work? Or have you all got wonderful supported institutions and they all want to do it? I'm guessing it's that one. Or anything else to add?
Actually, Karl, at my institution, as you said, it's just me. I started at the focal point of being the Nursing Now focal point at the Ministry of Health, and I worked along with them with the reporting, the state of the world reports and so on. And then when I had the chance to take these courses, I take it. I offered the idea, and I was really hoping if I ever would have the chance that I could include this in the curriculum, the nursing education. Because it's really useful. Unfortunately, I didn't get that support because of the financial. Most of our projects here in the Ministry of Health are depending on external support and sponsors like the USAID and the GIZ and so on. So they are offering just if you find a sponsor, you can go with it. But you can go benefit from it, as I said, personally, by spreading and applying what you learned at the community, at the work, even at your colleagues, your supervisors, and so on. And when they like the ideas, the much you, let's say, spread the idea, and when there are too many people who like it and request it, I think that just forms some pressure on the management that they might include this in some of the training exercises. And I hope that what is going to be ending in our ministry.
Thank you, Asma. Yeah, it's really interesting to hear the different experiences you've had kind of engaging with the Nursing Now Challenge and their initiatives, which are all fantastic, offer so much to nurses around the world. I would say as well, if anyone's thinking, how do I convince my management to let me onto the course and to reach out to my colleagues to get groups of us onto the courses, that's a conversation we're willing to have. Absolutely. You can reach out to us and the Nursing Now Challenge, and we can find ways to help support that in any way you'd like. I'm not seeing any other, is there one question here? Oh no, that's the one we've answered there. So please do, folks, ask any questions if you have any. I've run out of questions, so whilst we wait for maybe some more questions, we'll do a demonstration. Some breathing exercises were mentioned, so I'll take you quickly through a breathing exercise. Maybe we'll have a question ready in the inbox after that. So you can take part in this as well, folks, in wherever you are. Me and the panel will be showing you how to do it, so just follow along with us. So just make sure you're sitting comfortably. You'll see the panel have raised their spine and their head, and they're sitting comfortably, feet flat on the ground, and watch whatever space you're comfortable in. And we're going to do an exercise called alternative nostril breathing. It's spoken about in a book by James Nestor called Breath, the New Science of a Lost Art, going into the science of that. It comes from an ancient tradition called Nadi Shodhana. Maybe people who have yoga practice and from India as well would be more familiar with this than I am. We use this from a nursing perspective. So we use this as a way to lower the heart rate, reduce stress. And it's been particularly useful, we find, and in our experience, and my experience as well, if you're about to go into a stressful situation or to decompress after a stressful situation. So we'll take you through it very quickly. It's very, very simple. So I want you to take your right hand and I want you to use your thumb to block out your right nostril. So you're only breathing through the left nostril. I want you to breathe out of that left nostril and breathe in through the left nostril. Take your two middle fingers and close your left nostril and breathe out of your right. And breathe in. And close that right nostril with your thumb and breathe out with your left. And breathe in. And close that and breathe out. And breathe in. Close that nostril, breathe out. And breathe in. And close it and breathe out. One more time, breathe in. Close that nostril and breathe out. And relax. Thank you very much. That's alternate nostril breathing. Very good for lowering the heart rate, reducing stress, decompressing after something difficult, or preparing for something you might find difficult. We have a saying in HAT, in Health Action Training, that these breathing exercises are really good to do once or twice, but even better to keep doing as a regular practice. Return to what Rita said, it's part of washing the face in the morning, do your breathing exercise, brush your teeth, becomes part of a routine. What we like to say is, you go to the gym and you do a run and you lift some weights. You did it once, you wouldn't expect any changes, or many. But then if you do it often, you will find some changes. And the breathing exercises we teach are the exact same. So I'm still not seeing any questions come through. So maybe actually what I'll do to finish the session is invite the panel to ask other members of the panel some questions or anything. Does any of the panel have questions for anyone else in the panel? Or open things they want to say to
I can start asking them, what did you like most when you had your health action training? Like what among those, let's say, activities or exercise? I will start to answer my question first. For me, I like the four-room theater and the image theater so much. This is from Augusto Boal, if I would quote that one. So if you want to know more about that, join the Health Action Training.
Great, thanks. Hey, so yeah, the forum's always good fun. What about the rest of the panel? What was your favorite activity?
From my part, what I really loved during the graduate certificate training and this learning journey was the teamwork when we had to prepare our like role play at the end, and especially the Viva Voce. So this was my first time to speak about what I have learned, and that was amazing. I learned a lot. So it's not just another way of learning, it's also another way of thinking about issues. So yeah, this is amazing.
Thank you, Rita. And yeah, I mean, we found groups of people coming together and they're still talking, built friendships through being part of the same group. So it's a huge part. Thank you. Zipporah, see you unmuted there.
Yeah, well, Asma and I were in the same group. It's always so nice to see her. And I think that was my favorite part, the role playing, especially the part where we would all act out one character and then have to exchange, having to experience like both sides of the conversation. And then that led me personally to keep reflecting on every conversation I have had before that point, to actually understand what I may have done wrong or what I may have done right, and what I would like to improve. So that was by far my favorite session. Thank you.
Amazing to hear. Thank you, Zipporah. And Asma and Zoe, do you have any favorites?
Yeah,
Asma?
actually, nice to see you again, Zipporah. I was with Zipporah, as she said, at the role play. And the nice thing that we did is we used the forum theater while we were preparing our role play. So we were just playing, and I think each one of us at the group played different roles. So once I was the nurse, and then I was the family, the father, then I was the patient. So you can try different roles and try different perspectives, let's say, and improve the role play that you are playing. And that's the thing that I said, that you can learn what to do in real life, but using the drama. And I really like that, the role play mixing with the forum theater. The image theater as well was really, really interesting. And I really like the way that integrated the drama in the nursing. So you are taking the communication, the nonverbal communication, the image theater, and so on, and then just going how you are interpreting this in the Breaking Bad news, and being sympathetically present with others, how to do that, as well as sympathetic presence, person-centered care, how to actively listen, how to understand others, how to set the objectives with the others and respect them, and so on. So this interpretation and mixing of the two things I really, really liked.
Thank you, Asma. What a good response. And Zoe, what was your favorite?
Probably my favorite and more useful in personal and professional life was the Stanislavski approach about understand and reflect on our own objectives and how our actions can be not only I mean, they involve how, as Mayo say, with the body or the body language and so on, but also with our intention, like our interior intentions for the patient, and how we can help the patients to understand and accomplish their own objectives in these challenging situations, or in general in health. That was really interesting to reflect and to learn how we can observe and understand the objectives and actions we're doing when we deliver care. So that was really, really useful, even for my main objective as a person and as a nurse, what I want to do with this knowledge, what I want to do with my life, if you want to see it in that way, was really interesting, and is something I want to keep practicing and learning more about it.
Thank you, Zoe. I'm aware of time, folks, so I think that'll be the end of our questions. So I'll summarize here that we have courses coming up with Nursing Now Challenge, many more courses coming up. We have a few starting this month. We have 2 starting this month. All the information to find out about those courses and how to sign up, you can find via the links that we've been sharing. And the Nursing Now website, there is a section on there all about us. And you can have a look at that for the upcoming courses for more information. It should include contact details. I've just seen, yeah. So the link that Andrea through Nursing Now Challenge account has put the link there for you to follow and find out more information and register onto those courses. The registration for the courses this month will be live soon. They're not live yet, but keep your ear to the ground, as we say in the UK, for news on those. If you want to reach out to us, please feel free. It's been a delight to share the stage, the virtual stage, with my fantastic friends and colleagues, participants from Health Action Training. So I'm going to thank them all. Thank you, Asma. Thank you, Zoe. Thank you, Hazel. Thank you, Rita. And thank you, Zipporah. And last but not least, huge thank you to the Nursing Now Challenge and the Burdett Nursing Trust for making this possible in the first place. Huge thank you to Andrea, to Kate, to Hannah, and everyone involved in the Nursing Now Challenge for being such wonderful partners to work with. And I'm going to say goodbye there. Thank you all for coming. Hope to see you on some Health Action Training courses soon. Thanks, everyone.